are there any safeguards that needs to be put in place so that we ensure that even as we attract more visitors from outside our boundaries, then we also do not neglect the locals who cannot afford to pay top dollar for medical services?
Yes, indeed. The first primary safeguard is that any visitor that is coming into the country needs to demonstrate that they have a medical cover. This is a requirement that we see as visitors travel out of Kenya to other countries. When you visit the other countries in Europe or in the Americas, you're required to demonstrate that you have a medical cover so that you do not burden the citizens of that country with your medical expenses. And so that is one of the safeguards that is readily available, where we can then require that whoever travels into the country demonstrates having a medical insurance cover from their country that extends to this country, or that they purchase a local cover that then can facilitate them while in the country should there be need for medical attention. And therefore it means when medical bills arise, then they have a cover that will be able to take care of that and not then strain the taxpayer to meet their medical expenses.
Mm-hmm.
Yeah.
And what trends are likely to drive medical tourism in Kenya in the next 5 years, when you look into the horizon?
I think one of the things that we see a great number of times is that we have interactions with medical insurance providers, with the medical service providers. These are hospitals and clinics and medical centers. What I see is that more and more are these hospitals graduating from one level to the next level. So as we are getting more level 3 hospitals converting to level 4 hospitals and getting in more specialized services, then it is going to open up opportunities for people around the region to be able to come into the country to get the necessary medical services that they may require that may not be available in their country. So I think the growth of medical providers graduating from one level to the next level, improving service provision, is going to be a great driver. I was just reading an article not too long ago, and in this article, one of the critical things is doctor to population ratio should increase. So training more doctors and training more medical personnel does not just end with the doctors, but including the auxiliary services that are going to support the doctors in the provision of services. Nursing care, for example, having more specialized nursing care, because that's where health delivery is given. As we increase that capacity, then we'll be able to drive more people into our country, because we notice that in the region we are a front runner in health.
In this field.